Now, here is the killer that we want to stop. People die of strokes. People who die of strokes should not die of strokes. Or if they do, they should die of strokes 10 or 15 years later in their life. Why? Strokes are preventable. There is good management to prevent strokes. If somebody has even modestly high blood pressure, they should be followed and treated for life, not necessarily only by medication, but by change of lifestyle, by exercise, smoking, reduction, etc., all of the good things, but they should be followed. That the obligation of the health system is to see to it that they actually get the care they need to delay the stroke. If I asked you how many people here have had somebody in their family die of a stroke, I don't know how many hands will go up, but let me try. How many people here have had somebody in the family die of a stroke? Now, assuming that person was precious to you, your father, your uncle, whatever, you have a reason to take to your heart, this is important. This is what causes a 4 or 5 year difference between Macedonian mortality or survivability and comparable countries or other countries of Europe. Not necessarily the wealthy countries, because there are differences, there's no question, there are differences. But here the health system can be effective. And if doctors don't believe that hypertension is important, it's up to the medical community to try to reorient them to the issues of hypertension. You have a very good European College of Cardiology who set standards. They're similar to the American standards. That kind of education is important, not only for doctors, but for patients, family of patients, because the wife who makes the meals, puts the salt in the food, her hypertensive husband, age 45, is going to lose 5 or 10 years of life. So it's one of the magic bullets we have, but we have to use it. This is a very old slide. This was quoted in the CDC, the Centers for Disease Control, review of the 20th century. I like these kind of curves. What does it show? Deaths from pellagra. You all know pellagra. It was a common disease in the early part of the 20th century. It's a vitamin deficiency. In those days, people thought it wasn't a vitamin deficiency. They thought it was infectious. There was an outbreak of pellagra deaths and disease in the United States, and this was the death curve. You can see that women died much more than men, and you can see that there was a peak and then a fall-off of the disease because somebody went to investigate. And in the investigation, he concluded it was not infectious, it was a nutritional disease. Now, from this, the American public health community learned that nutrition is an important public health issue, and that micronutrients are themselves very important factors. We've had 10 years or 9 years of graduation of people trained locally here in your country in public health to a reasonable degree. It should be accredited at a European level so your students can graduate and say, I graduated from an accredited European School of Public Health. And that will add to their prestige, their job potential. The Ministry of Health should be recruiting these people into the system and requiring this kind of training for people who are moving up the ladder into leadership roles. This is an announcement in the BMJ of 3 days ago. It was published the 8th of November. I accessed it 3 days ago. It's the BMJ announcing that the U.S. government, the Federal Food and Drug Administration, is going to ban the use of trans fats in production of food. Now, it sounds like a technical issue, but it will reduce heart disease, it will reduce death, it will reduce hospitalizations, and it's a public health obligation. We talk about rights, we also have to talk about obligations, that the country needs to do this kind of act to reduce disease in the population. That's not to point out an individual patient, it's for the risk of the population. These are finally my agenda to promote public health in Macedonia. Basically, I've said them all, so I won't go over them again. I've written them up and I've given them to the Minister of Health this morning. And I hope it will be an agenda that will affect policy in this country in the coming years. And finally, may I say, I've always liked coming to Macedonia. I hope to continue to come in the future and to see you progress in these areas. Thank you very much.